The chairperson of the Ministerial Advisory Committee on COVID-19 vaccine, Professor Barry Schoub, is saying this afternoon that more studies on the vaccine AstraZeneca need to be conducted. The rollout, as you know, has been suspended after an announcement that its vaccine only offers limited protection against mild disease caused by the variant that was discovered in South Africa. It is by all accounts a disappointing setback, to say the least. But let's try and make some sense of this as I talk to Professor Barry Schoub. Barry, good afternoon to you. First of all, the prevailing sense that we have this afternoon is that we've wasted our time and our money. What's your view?
No, look, I think that the whole problem was that we had the onset of this particular variant, the variant that was isolated in South Africa, the so-called 501YV2 variant. Now, that is totally unpredictable. We didn't realize, we didn't prophesize, we didn't foresee that there would be this variant arising. And moreover, we didn't prophesize that it would actually escape the immune system caused by any vaccine. So at the time when the order was placed and the order was done, this was without any of that knowledge, and it was really it was to kind of get vaccine to our healthcare workers as soon as possible. You recall we were in the middle of the second wave, very severe wave, and the healthcare workers were being overwhelmed and overswamped and so on. And it was a public health necessity to get them vaccinated as soon as possible. And this is really where this is why the vaccine was ordered at that time. Only later, in fact, about 2 or 3 days ago, is where we really discovered from the trials that in fact it had considerably reduced efficacy. So it couldn't have been foreseen.
The decision to bring it in, and I absolutely understand the importance of protecting our frontline workers. With hindsight, was there too much urgency? Was there too much pressure? Should we have perhaps interrogated this a little bit more, or was it completely, as you suggest, unforeseeable?
I think the latter. It was completely unforeseeable. I think the order for the vaccine was done with all good intentions. There was certainly a lot of pressure to kind of get the healthcare workers immunized. This was a vaccine which was available. Our committee advised the Department of the Minister and the Department of Health to take whatever vaccine did come about, the earliest, the sooner, the better. And certainly we were reassured that the AstraZeneca vaccine, from studies overseas, numerous studies overseas, that was a very effective and a very safe vaccine, including in the UK where they had a similar variant, also a 501 variant, not with the mutations that we've got. It worked well there. And in addition, our particular variant in laboratory studies overseas also showed that vaccine individuals did have antibodies which did neutralize the variant. So it was really unforeseen. The only way that we could really kind of assess that the vaccine wasn't effective enough was when the trial data was analyzed, and that could only be done very, very recently. We couldn't have done it earlier than that.
All right.
So it's very unfortunate.
Professor, let me ask you this now. The drug as it stands, to the best of my knowledge, we have something in the region of 1.5 million doses. They are sitting in storage. Is that consignment now completely useless, or can it be used when further work is done on it?
No, we are certainly going to do further work on it. There are a number of avenues which are being explored. First of all, the most important one is that, and Professor Marty mentioned it last night, there may well be indication that it does quite efficiently, protect against severe disease, hospitalization, and mortality. So that still has to be exploited as well. That's the one thing. The other thing is there are other arms of the immune system, which maybe the AstraZeneca vaccine may be quite effective in stimulating, such as the cell-mediated immune system, the innate immune system, and so on. And that has still to be investigated. Then we're also going to look at whether the AstraZeneca vaccine can be combined. It's a 2-dose vaccine, to have one of the doses, either the prime dose or the boost dose, the first or second dose, to be the AstraZeneca. So these are still things which can be still examined. But in the interest of really getting the optimal rollout, we decide to suspend the AstraZeneca vaccine for the moment until those investigations are successful.
How long is that going to take, Professor Schoub, given that there is also concern about the looming expiry date?
Yeah, well, that is the problem. That expiry date is unfortunate. There are negotiations going on with the Serum Institute of India, who make the vaccine, to ask them, do they have data from trials overseas where the vaccine has been given beyond that expiry date and is shown to be successful? And if that is so, then we can extend the expiry date. Otherwise, you're right, then it's going to be a juggle. What can be achieved before that expiry date, if in fact the expiry date is hard and fast?
What would that juggle entail?
Well, doing those investigations, for example, the cell-mediated immune response one, doing trials with mixing AstraZeneca with another vaccine. These may be information coming out from overseas investigations, if that comes out before the expiry date. And as you say, this is the big question. You know, will we get that information before the expiry date? Time will tell.
Is it your opinion, Professor, that enough due diligence was done on the importation of this drug, given that it arrived and we only discovered some days later that there was an expiry date? It seems extraordinary, doesn't it?
I agree with you. I'll be quite honest. I must plead ignorance because I'm not at all involved, and our committee is not at all involved in the actual procurement. The procurement really is done by the Department of Health. We advise get this vaccine. But the actual administration of the actual procurement, we're not involved in it at all. So I'm not exactly sure what the kind of nuts and bolts are in actually getting a vaccine and procuring it and buying it. There may well have been, unfortunately, I can't answer that question.
Suffice it to say that, like many of us, you must be alarmed that we now have this vaccine that is effectively effective only for a couple of weeks. I mean, it is extraordinary, isn't it, Professor?
Well, it's a bit more than a couple of weeks. I think the expiry date is about mid-April, I think. Somewhere in April.
Let's call it 10 weeks.
It's a couple of months.
Okay.
10 weeks. Oh, yeah, okay. Yeah, look, it is unfortunate. I agree. Normally vaccines have a shelf life of about 6 months. So this is now being cut down to just over 2 months. If it would have been an effective vaccine, and we could have immediately started the rollout and given the 2 doses as recommended by them of a 4-week delay between the 2 doses, we probably would have got away with it. But now with the variant issue, that has added the complications, of course.
Do you believe we have enough capacity to investigate this in the time that remains, the 10 weeks, the 2 months?
Well, that's a difficult one for me to really answer because it does involve a lot of work. It does involve a lot of investigation. And what they can accomplish it in that time, I think you and me can kind of, hazard a guess.
So where do we stand now? We're pinning our hopes on Johnson & Johnson, are we?
Well, Johnson & Johnson has been shown, and it was kind of demonstrated last night by Professor Glenn, both studies here and overseas, that it is very successful, first of all, and this has been shown, it's not hypothetical, in reducing severe disease and mortality and hospitalization. And that, of course, is the prime goal, the prime aim of the vaccine. So that has been shown, and certainly it will be effective for that. It also is reasonably effective against moderate disease, which of course affects the economy and, of course, the health of the people, and is effective against mild disease. So I think all of those has been shown with our variant. I think the critical thing is what has been shown with our particular variant, and that can only be done in studies in South Africa because it's over here where that variant is dominant. And that's the problem because overseas they don't have this variant. So we can't get that knowledge from overseas, how it behaves in the field. We can only do it in South Africa from people who were on the trials. And fortunately for us, those Johnson & Johnson trials were done in the main with the variant, only maybe a few stragglers before the onset of the variant, but mainly the variant, and therefore that's very valuable knowledge.
All right, a final question, Professor Schoub, and this is probably the most important one. How does the scientific community, yourself included, now convince citizens that the country has a plan that is going to work? Because you'll concede after this AstraZeneca upset, call it what you want, there is growing skepticism in the country. You, as a scientific leader, have a responsibility now to tell us it's going to be okay.
Well, I could turn it the other way around. The way I would interpret it is that we've got a tremendous depth of scientific knowledge and scientific expertise. If we didn't have that, we wouldn't have picked up the variant. That relied on very sophisticated, what we call genomic surveillance of the genome, to have picked up in the first place. Second of all, to do the laboratory evaluations, which supported those mutational changes. And thirdly, to do very good trials, which we've done. So I think that we can reassure the public that we certainly got the science to be able to pick up any problems, either in safety or in efficacy. This is an efficacy problem, but we would have the same scientific depth to pick up safety problems. And I think we can reassure the public on that. And we do have a fallback position, which is as good as the original one. We are getting vaccines, I think as your news bulletin just said just now, very, very soon, the Johnson & Johnson, which we know from science, from scientific evidence, does work. And I think we are fortunate that we do have the scientific resources in this country. Otherwise, really, we would have been in trouble.
I appreciate you joining us, Professor Barry Schoub, Chairperson of the Ministerial Advisory Committee on COVID-19.